All right. And so why don't you tell me a little bit about your history, what brought you in, the headaches, how intense, how often that was happening.
Okay. So I had a concussion probably about 4 years ago, back to back, 2 concussions, and then another one after that. So it was like 3. And so I just haven't been able to find relief the last 4 years. And then I found you and I decided let's try it, and I talked to you about it. And our first session, my headaches have been every single day for the last 4 years, and they were like a 10 out of 10, awful. Just woke up every day and I just thought that's just how it was going to be.
All day, every day, like
every
this
day.
is just my life now.
Yeah. And then I just got used to it. So then our first session, you told me I could probably be feeling, some I've had a lot of surgeries as well, so the anesthesia and everything would
Like
probably come out.
detoxing.
There's the word. And the first thing I noticed was, yes, I did detox, but my headache was like cut in half. And I don't know, we're a few months.
Mm-hmm.
I don't even know how many.
Yeah, we haven't been super consistent,
Right.
and so I think today's like your 5th or 6th session,
yeah.
And it was more consistent in the beginning, so I think we had like maybe 3 or 4 that was once a week.
Yes.
And then the last couple have been like a month or 2 apart,
right,
I think.
Right, yeah. And since then, my headache has not gone back to the 10. So I'm at like a 3, 4 almost every day, but I've noticed it's kind of scaling down to like a 2 some days. And then if I do get a headache again, it's like back to just that 3 or 4. So nowhere where I was at all. And just overall, I've seen just changes in my body of the detox period for me was really long, and now I'm starting to feel like good, and I feel when I don't see you, my body can tell, and I'm like, oh, I need to go see Dr. Ravi again. So so definitely all good things, and you've been super patient with my body because it doesn't work like everybody else. So
it's interesting that you brought that up, because I have actually started using you as my example of when I'm doing the consult explaining how normally people detox. And then I say I've only had one person in 10 years that detoxes after the 3rd session.
Yes.
And you were that one
me.
person.
But I was like, no, just stick with it. Let's see how it works.
You also have fibromyalgia and some other conditions.
Yes.
And you also have experienced, I remember from our first conversation, you knew essentially that you were going to not detox like a normal person. Like you're like, every time I see a professional, I'm the abnormal case.
Yes,
that
absolute opposite. And I proved myself right. So, but I just love that you just